Well, new today, the BA.2 subvariant of Omicron has become the dominant strain of COVID in the U.S. That's according to the CDC, which together with the FDA gave the go-ahead for some high-risk groups to get another booster. THV11's Sarah Herbakowitz explains who needs this shot and why.
It's been a busy day here at Kavanaugh Pharmacy in Little Rock as people go in to get their fourth booster dose. And I know what you're thinking, another news story about COVID. But this time, doctors are hoping that this dose helps prevent a future spike.
And I think getting ahead of it is exactly the opportunity that we don't want to squander.
An opportunity UAMS Dr. Paul believes could maintain protection before another wave.
So if we have a vulnerable part of our population that is at risk for becoming infected, getting that population vaccinated, or in this case boosted, should help mitigate any additional surges.
Immunocompromised people can also get a new boost. And in just the few hours since the CDC's recommendation, Kavanaugh Pharmacy saw about 60 patients come in.
People over 50 that have been 4 months since their first booster shot.
Studies show that months after each vaccination dose, protection against COVID begins to fade. U.S. health agencies don't consider it a problem for healthy adults and children, but for at-risk groups like seniors, a fourth shot is now allowed.
Luckily, we already have those processes in place from the last 2 years of vaccinations.
And the Arkansas Department of Health is keeping a close eye on protection as a new Omicron subvariant spreads.
People who didn't get the booster dose were not as nearly protected from the Omicron variant as those who got that booster dose.
And with the new BA.2 virus dominant in America for the first time, they're hoping it doesn't cause another spike.
We have been tracking it for that reason, but right now we're not seeing that, and we're hopeful that it won't happen.
Preparing now for the risk that future variants could cause future spikes.
I don't think anyone has the patience or the tolerance for another surge.
Reporting in Little Rock, Sarah Herbakowitz, THV11 News.
Thanks so much, Sarah. One last update to the vaccine recommendations. This one is for folks who got the J&J shot. The CDC says based on a new study, people who only got J&J need a boost with Pfizer or Moderna. This was already the case for people who got a single shot, but now the CDC says even people who got 2 J&J shots should go ahead and do the mix and match because that's the best way to bring your immunity up to full steam.